So my name is Paul Scullard, I'm a GP in Nottinghamshire. The NHS is changing and evolving, and we're now able to offer additional services within your community. Primary care networks are groups of local GP practices that are working together with wider providers in Nottinghamshire to enhance the care our residents receive. We want to provide more care and more joined up care, allowing patients to see the right person at the right time. PCNs are employing more staff to support patients closer to home. For example, pharmacists, physiotherapists, mental health workers and social prescribers. And these staff are able to provide more accessible and more specialist support to patients. And you should start seeing them in the community and at GP practices. There are 23 PCNs in Nottinghamshire, each is based around a small geographical area, and this is something that is replicated nationwide. PCN staff and GP practices are working together with community providers, social care, pharmacy, hospitals and the voluntary sector to provide this new service. PCNs will be at the heart of the health and care provision going forward, improving the wellbeing of our local population through proactive, accessible and coordinated health and care services.
Hi, we are care coordinators. We can help you get the right care for your healthcare issues. We act swiftly to help you find the right support from a variety of teams and services. We also help you navigate through a healthcare journey.
We work with healthcare professionals and services across the primary care network and wider community to help you get the right care when you need it. There are a range of healthcare professionals working at your local surgery and in the wider community who will help you get to the right person or service for you.
Let's take a look at some of these roles and how they can help you.
Hi, I'm Simran. I'm a physician associate working in a local GP practice. As a registered PA, we are able to diagnose, treat and manage patient health as a GP would, but cannot prescribe medicine just yet. We can read ECGs and interpret chest x-rays and scans. We are here to supplement a doctor but not take their role, just help with their workload. As a PA, we can support healthcare staff, do ward rounds, chase results, review patients, manage their treatments, carry out examinations and take bloods, in addition to a variety of other clinical skills.
As a clinical pharmacist, I work with you and your healthcare team to ensure we are offering you the most appropriate, safe and effective medication. I listen to how you're getting on with your medications and I look at everything you're taking. My aim is to support you to get the best from your medicines and reduce waste. It's all about empowering you so you know how best to take care of yourself.
Hi, I'm a clinical pharmacist working within local GP practices. I have appointments which can either be face-to-face or by telephone with patients for their regular structured medication reviews, where we talk about making sure you have the right medication, how and when to take your medicines, and give you information on side effects that you may be having, and give healthy lifestyle choices. I can also talk about starting new medicines or stopping any medication that are no longer appropriate. I can carry out cardiac examinations and optimise medications for heart failure. I can also help manage conditions such as high blood pressure, asthma or diabetes, and answer any questions you may be having about your medicines.
I'm a pharmacy technician and work in local GP practices. I work under the supervision of a pharmacist and I can have face-to-face or telephone appointments with the patients too, offer advice on managing medicines, provide information on potential side effects, refer you to your community pharmacy to recommend over-the-counter medication for common illnesses such as cough, colds, muscle pains, along with referring you to other community services. I can contribute towards safer prescribing of all the medicines you take. I can help ensure your practice records are up to date following a recent hospital discharge or after a review in a clinic. I can help bring your medicines into line to make ordering your prescriptions easier. I can also carry out blood pressure, pulse, height and weight measurements and check your inhaler techniques. I also offer advice on health and lifestyle choices.
I'm a dietitian and I work with you to understand how food and drink is affecting your life. I'll listen to you and we'll look at whether there are any changes that you can make to improve your health and well-being. We'll work together along with the people who care for you and your healthcare team so that you understand how to get the nutrients you need through what you eat and drink. I most often work with people who are losing weight but can also help with dietary advice in a wide range of situations, including diabetes, overweight and dementia.
As a social prescriber, I spend time with you listening to what is important to you and offering practical, achievable suggestions to help you make changes that could improve your day-to-day life. I then work with you over a few weeks or months to support you to achieve your goals. We can look at everything from feeling worried or anxious about money, relationships or work, to wanting to find time for yourself and feel more in control of your life.
As a health wellbeing coach, I help people make positive choices that enables them to live healthier lives. I listen to what's important to you, and together we identify a positive goal for you to work towards. I support you to develop your own knowledge, skills and confidence so that you feel more in control. We'll work towards that goal using a variety of motivational techniques. I'll keep in touch to offer advice, support and encouragement. I can also recommend or offer classes, community activities and support groups which can really help, particularly if you're living with long-term condition.
I'm Helen Miller and I'm a senior mental health practitioner working in local GPs practices. As a mental health practitioner, I can take care of your mental health, whether that's through drug treatments or alternative therapies. I can help with individuals who may benefit from time-limited treatment regarding psychoeducation and mental health awareness. Brief intervention to re-stabilise those with severe mental illness at risk of relapse who are not already receiving mental health care. I can also do consultation work with professional services. I can signpost various services that can help the individual.
Hi, I'm an occupational therapist. Occupational therapists help people to participate in daily life to the fullest. We can help when a person's engagement or functioning in their activities of daily living, like washing and dressing, working, hobbies, eating, sleeping, are disrupted due to illness, disability, trauma or ageing. Within my role, I offer support which focuses on mental health and how it may be affecting your daily life. I spend time understanding what you need and want to be able to do yourself, taking into account all aspects of your life and helping you to identify and break down the barriers to achieving this. Our support helps with anxiety and mood management, regulating emotions, developing motivation and interest levels, re-engaging in hobbies and important roles within our life. We use the activities that are meaningful to you as a tool to help you engage in everyday life. Together, we will develop a plan to support your mental health, enabling you to be more independent and feel more in control of your daily life.
As part of the Nurse and Associate team, we look after people who can't get to the practice. We can visit you at home to check on your health and well-being. I'll listen to how you're feeling and maybe carry out some tests so that you don't have to come to the surgery, like taking your blood pressure and checking your heart rate and rhythm. I'll take these back to the nurses and doctors in the surgery who'll then review it. Together, we make holistic assessments of how you're getting on and whether there are any risks of falling or skin damage. If needed, I can talk through some choices you might have for more support to help you to live at home. I can also make referrals to my colleagues in the practice or community health teams. I often visit and spend time with frail patients or those living with long-term health conditions to ensure they're getting high quality care even if they can't come into the practice.
Hi, I'm an advanced physiotherapist based within the medical practice. I offer quick access to assessment for people who are experiencing bone, muscle or joint pain and also other problems such as back pain and related nerve pain. Together, we work to understand the cause of your discomfort. I'll explain my diagnosis and what is going on in your body. We'll discuss my advice and appropriate exercises to manage your pain. If required, I can refer on for imaging such as x-rays or scans, for physiotherapy or to specialist services. People waiting for operations can also see me for support to ease their symptoms and enable mobility.